Hello, and thank you for joining me today for an introduction to mental health. My name is Kim Zimmerman, and I am a health promotion specialist at North Central Behavioral Health Systems. Over the next hour or so, I would like you to learn about mental health, some common mental health problems, and some tips to help you be mentally well. This webinar is pre-recorded, so if you have any questions, please email me and I will reply to your question as soon as possible. And I will share the email address with you at the end of our presentation. We are going to start today by talking about what is mental health. The World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can work productively and fruitfully, and is able to make a contribution to his or her community. Some people define mental health as an absence of illness. Others see it as a general term, neither good nor bad, just a matter of being. As you can tell, the World Health Organization sees it as a state of well-being, meaning that it is positive. Generally, people are in good mental health. They are generally healthy. However, no one ever stays in a static state of well-being. Nobody's ever always positive, always in a good mood, always happy. Mental health is definitely not just a simple definition. Throughout our lives, we will fluctuate between good and bad. Some days are better than others. A state of good mental health has a few key characteristics. Usually the person is in control of their emotions. I apologize. They have good cognitive functioning, and they generally can interact positively with other people. They are able to perform well at work, at school, with their family, and have meaningful relationships with other people. Good mental health will allow a person to fulfill their roles in society, whatever that role may be. Each one of us plays several roles, and they're all different based on our lives. For example, you might be a mother, a grandmother, a teacher, an aunt, a neighbor. You might sit on a committee and be a leader on that committee. You know, for myself, I am a colleague, I'm a friend, I'm a daughter, I'm an aunt, I'm a coach. Some days I'm a teacher. Think about what role you might play. When people can no longer fulfill these roles as you have in the past, or as is expected of us, some would say that we may be in poor mental health, especially for a prolonged period of time, sometimes defined as a mental health problem. Mental health problems come in two forms, if you will. One would be a defined mental disorder or mental illness, which is usually diagnosable, and it's going to interrupt the person's thinking, their emotional state, and behavior, and it's going to disrupt their ability to work, carry out their daily activities, engage in satisfying personal relationships. They're not going to be able to fulfill those roles that they are supposed to be playing. The other term that we might use, and I'm going to use, is more general or more broad. It's called a mental health problem or a mental health challenge. And this is going to include both mental disorders, but also not necessarily diagnosable, but symptoms of a mental disorder. Mental illnesses are medical conditions that disrupt a person's thinking, their feeling, their mood, ability to relate to others, and their daily functioning. They often result in diminished capacity for coping with the ordinary demands of life. Oftentimes, people with mental health problems are seen negatively. There's a negative stigma surrounding that particular disease, disorder, person, whatever it might be. Individuals who have mental health problems may feel ashamed or embarrassed because of the stigma attached to the problem. They become labeled as crazy, psycho, whack job, and people see them as their problem or their disorder rather than the person that they are. They see them as he is depressed or she's psychotic rather than he has depression or she has psychosis. Someone who is struggling with a mental disorder or is facing a mental health problem may have a difficult time fulfilling their roles within society. They're not able to function in their daily lives as they maybe once had. Oftentimes, people with mental health problems or disorders will feel very lonely and isolated, like they are very different from everybody else. They'll feel ashamed. However, the opposite is true. They are not alone. They are not isolated. It's important for them to know and realize that mental health problems are common. If we go and look at some of the numbers, we can see that not a huge majority of people in our population have mental health problems, but it is common, and knowing that sometimes can help us feel a little bit more included and not as much isolated. According to the National Institute of Mental Health, 1 in 4 adults in the U.S. will have experienced a mental health disorder in any 1 year. That's roughly 57.7 million people. Mental health problems are more common than cancer and heart disease combined. Mental illnesses do not discriminate. They can and will affect anyone, men, women, children, regardless of gender, race, ethnicity, socioeconomic status. There are approximately 10 to 20%, depending on what research you're looking at, of children and adolescents that are experiencing severe mental disorders in any given year. Unfortunately, more than half of the U.S. population and over 70% of children and adolescents are not receiving any treatment for their disorder. The people who do suffer from mental illness or mental disorders will oftentimes have multiple illnesses at the same time. This is called co-occurrence. They sometimes will co-occur with other disorders. For example, a person might have depression and an anxiety disorder, or they might have an anxiety disorder with a substance use disorder, or sometimes they might have 3 or 4 different disorders at the same time. With so many people being diagnosed and so many more not receiving any diagnosis for treatment, the impact of mental health problems can be quite staggering. If we look at the impact of mental illness, it's going to not only impact the person who is experiencing that illness, but it also affects their family, the community, and society as a whole. Mental illness has a huge impact on the individual all the way through society. For the individual, mental illness can be quite disabling or disruptive to their lives, their ability to work, care for themselves or their family, and have satisfying relationships. The World Health Organization reported that 4 of 10 leading causes of disability in the world are mental disorders. And by the year 2020, major depressive illness will be the leading cause of disability in the world for women and children. And disability really is just defined as disruption of your normal daily lives, like going to work, caring for your family, caring for yourself. Thus, if the person can't take care of themselves or go to work and do those kinds of things, it's going to impact their family. Their family might have more responsibility. They're not getting cared for. They might not have as much money to pay the bills, to make rent. They're constantly worrying about their loved one. They're having to take care of their loved one maybe, and kind of continues to trickle and trickle down through the impact of our community as well as our society. Most of the cost of mental illness is more indirect than direct, so it's hard to actually put a number or a price tag on the cost of mental illness. But when you're looking at care, treatment, and medicines, those kinds of things will be direct costs. Those are things that we can maybe measure, while indirect costs are more challenging to quantify. They would be things like reduced labor or productivity, the cost of public aid, reduction in education, which means the person's maybe not going to be obviously is educated and therefore making as much money as they possibly could. Other costs associated with incarceration or homelessness. There's a large population of our homeless and those in the prison system who do have mental health illnesses. And then other medical expenses, for example, ER visits and early mortality for people with mental illness. It is estimated that the economic cost of untreated mental illness is more than $100 billion each year in the United States alone. Unfortunately, in many states, mental health and even healthcare funding is in general is being cut dramatically. So when people do try to get help, it's hard for them to find the facility. They're oftentimes waitlisted, the lines are really long, or they can't afford the care. Treatment should be available to all who need it, but if we can educate ourselves on what to look for, how to help, and who to go to for help, we might be able to reduce this need. Early intervention and treatment has a huge impact on a person's ability to recover, and that's what it's all about, finding a way to recover, to be healthy again, to be happy again, to fulfill our role, and to live just a good quality life. Over the next hour or so, I'm going to talk about some of the more common mental illnesses. We're going to discuss some signs and symptoms of each one and what to look for, and where we can go for help. And then I want to talk a little bit about how we can stay mentally well or maintain our mental wellness by learning how to cope with some stuff that might happen in our lives. Research is showing that mental disorders are a brain disorder, but we can still reduce our risk of developing one by taking care of ourselves. For example, we know that what can cause heart disease, and if we stay away from those particular things that increase our risk for heart disease, we can reduce our risk of developing heart disease and thus live healthier and longer. Some common mental disorders, these happen to be in order of commonness. The percent of U.S. adults kind of trickle down. So with anxiety disorder is the first one. It's the first one we're going to talk about. There is about 18% of the population in the U.S. that has any anxiety disorder, and there are several, followed by major depressive disorder, substance use disorders, bipolar eating disorder, and schizophrenia. And the bottom three are relatively low in terms of, they're not very common. For example, about 1% of the population has schizophrenia, but I did want to just add it into our discussion for today, and we're not going to talk about all of these disorders, but I just wanted to add it on here because schizophrenia tends to get a really negative thinking or showing behind it. So I wanted to just talk a little bit about, what are some things to look for in terms of that. Why do people get mental illnesses or disorders? What causes them? Research doesn't really know exactly what causes our mental disorder, but we know that there are factors that might increase our risk of developing a mental disorder. So some might be a combination of genetic, biological, environmental, or psychological factors. Some factors that might increase our risk are family or personal history. Does somebody in our family have a mental illness? Have I had experienced a mental problem or challenge at some point in my life? If those answers are yes, our risk is increased. Some factors are, or physiological, chemical imbalances in the brain, environmental, major life changes, bullying, divorce or breakups, living in conflict, having a distressing childhood or family background sometimes can be an influence. If we've lost a partner, a family member, or a friend, and that not only could be from death, but potential moving away or like divorce or those kinds of things. Major illness or traumatic events can lead to or increase our risk, I should say, of a mental illness. Our sex, male or female, hormonal changes, substance use, and certain medications can change the way our brain works, and thus increasing our risk. The first disorder we're going to talk about today is anxiety disorder. Everybody experiences anxiety from time to time. It's a normal reaction to stress, and it actually can be beneficial in some situations. For some people, however, anxiety can become excessive. While the person suffering may realize their anxiety is too much, they may also have a difficult time controlling it, and it may negatively affect their day-to-day living. The person may feel extreme tension or fear when there is no real danger or threat. They may take extreme action to avoid the source of anxiety. Generally, people who experience an anxiety disorder, their anxiety is far more intense and longer lasting than what would normally be, and it's going to interfere with their life. Collectively, anxiety disorders are among the most common experienced by Americans. about 40 million Americans are affected each year, and that would be 18 years and older. Women are 60% more likely than men to experience an anxiety disorder over their lifetime. And a large national survey of adolescent mental health reported that about 8% of teens ages 13 to 18 have experienced an anxiety disorder, with symptoms commonly emerging around age 6. The average onset of an anxiety disorder is 11 years old. However, of this 18% of our 13 to 18-year-olds, of our youth and adolescents, only about 18% of them are receiving mental health care or treatment for their problem. I mentioned that there was several different types of anxiety disorders. There are actually 5. And I'm not going to go into them too much, but just a brief kind of description of each. We have phobia disorders, so those are specific or simple phobia, which is fear of particular objects or situations, such as fear of insects or flying or heights. Social phobia is another type of phobia, and that's fear of being judged or embarrassed, such as fear of public speaking or meeting new people. Sometimes social phobia, people are just afraid to go out and be where there's other people. And then agoraphobia is a fear of being trapped in places or situations, such as being in a crowd without any escape. Panic disorder, the person feels a sudden, intense sense of doom and feeling of dying or losing control. It's very, very terrifying. It has physical signs, which we'll talk about in just a little bit, but usually the person has rapid heartbeat, chest pains, they might feel nauseous or dizziness, trouble breathing. They're going to think not only that something's going to happen to them, but that also that they're going to die of what they're feeling, that they sometimes will fear that they are having a heart attack. Panic attacks may lead to, or panic disorder may lead to depression, substance use, or agoraphobia. So some people will fear having a panic attack in public, and so they will develop that agoraphobia so they don't leave their house. Generalized anxiety disorder, or GAD, is just a kind of general constant worry or anxiousness about routine daily tasks, for example, paying the bills or their health or performing duties at work. This person may have trouble concentrating, feeling fatigued, but still not able to sleep. They might be irritable, restless, have headaches or muscle tension. OCD, obsessive compulsive disorder, is probably an anxiety disorder that we've all at least heard of. This person usually has obsessive thoughts, okay, maybe, for example, a fear of germs, and they're going to have compulsive behaviors, constant hand washing, constant checking, those kinds of things. OCD will consume this fear, this anxiety is going to consume a lot of the person's time, and it's going to definitely interfere with their daily life. Post-traumatic stress disorder, PTSD, usually occurs with victims of trauma. It might be from natural disaster, car crashes, violence, war. We are seeing an influx of our war veterans with post-traumatic stress disorder, and the government's doing what they can to help these individuals. They may relive the trauma through flashbacks or nightmares. They might constantly feel on edge, get angry quickly, have trouble sleeping. They might startle easily. They might start to shut off the outside world by avoiding reminders of the event or by growing numb. Depression and substance use disorder, or substance use, I should say, are common with people with post-traumatic stress disorder. Some specific signs and symptoms for anxiety disorders when we look at the physical aspect of things. Again, we've all experienced maybe that rapid heartbeat, chest pounding, when we're nervous about something, when we're scared about something. For somebody who is to be diagnosed with an anxiety disorder, these symptoms or these feelings are going to last for at least 6 months. They're going to have them every day, and it's going to be relatively intense, difficult for them to manage. The physical signs of anxiety might mimic that of a heart attack. Oftentimes people are going to seek treatment for their physical ailments. I'm going to go to the doctor because, man, I've had this headache for a couple weeks and I'm having trouble breathing. my muscles have been sore, I'm going to go to the doctor to see what's going on, and they would be referred to or diagnosed with potential anxiety disorder. So our hospitals, our emergency rooms, our physicians are seeing, they're kind of on the front line for these anxiety disorders and other types of mental illnesses, because we don't often go to the hospital or the health care facilities for, something's going on in my head. It's more of, oh, this hurts. What can I do about it? So those physical signs are going to be a trigger. People are going to go see their doctor about that. Psychological signs and symptoms are usually an unrealistic and or excessive fear and worry about past or future events. I mentioned some of these examples when I was talking about the specific disorders. And then we have our behavioral signs and symptoms. Usually this person is going to try to avoid situations. They might just have an intense or increased anxiety about other situations. They might start to fear things or have those obsessive behaviors. Anxiety disorders commonly occur among other mental or physical illnesses, including alcohol or substance use, which may mask anxiety symptoms at first, but oftentimes will make them worse. In some cases, these other illnesses need to be treated before a person will respond to treatment for the anxiety disorder. Effective therapies for anxiety disorders are available, and research is uncovering new treatments that can help most people with anxiety disorders lead productive, fulfilling lives. Another disorder we're going to discuss today briefly is depression. Everyone occasionally feels blue or sad, but these feelings are usually short-lived and will pass within a couple of days, maybe a week or so. When you have depression, it's going to interfere with your daily life. It's going to cause pain for both you and those who care about you. It is common, and it is a serious illness. It affects millions of people each year. However, depression is widely misunderstood. It is a mood disorder, and I'm going to talk briefly again about a couple of the mood disorders on the next slide. And it can affect anyone. However, women are more likely to be diagnosed with depression than men. We don't know why this happens, but it may be the result of biological differences or because women are more likely to seek help for their depression. Depression, also known as major depressive disorder, is one of the most common mental disorders in the United States. Each year, about 6.7% of U.S. adults experience major depressive disorder, with women being more likely than men, which is about 70% of women. Women are 70% more likely than men to experience depression during their lifetime. The average onset is about 32 years old. Additionally, about 3% of our 13 to 18-year-olds will have experienced a seriously debilitating depressive disorder. 15% of persons with depression take their own life by suicide, and suicide being the 11th leading cause of death. Interestingly, major depression is associated with more annual sick days and higher rates of short-term disability than other chronic diseases, also lost productivity and increased use of alcohol and drugs. So mental illness or mental wellness is very important for our community or our society, because people with a mental illness are not engaged and they are not oftentimes able to work. They're missing work, so we're paying more money in healthcare where we have more sick days, more lost work time, less productivity going on. So it's really important that our workforce and our work environments understand the importance of mental wellness and maybe start to address that. A major depressive disorder will last for at least 2 weeks and affects a person's ability to fulfill their roles. They may not be carrying out the work responsibilities, taking care of their family or themselves. They might, two key signs for depression is that they're going to lose interest in activities, things that they once loved, enjoyed. They don't really care about doing them anymore. They might start to isolate themselves from others. They're going to feel very little pleasure or enjoyment in their life anymore. They might obviously feel sad or disappointed. They're going to begin to feel confused or anxious. And again, there might be some physical signs, physical symptoms. They're going to have aches and pains, fatigue, loss, sleep problems, which again is why they're going to seek, why some people would seek treatment. You know, they're going to go to their doctor, and their doctor's going to ask them questions, and they're going to be referred then to a mental professional. Also, the person is going to have low energy or restless feelings. They just don't feel like getting up and doing stuff anymore, you know. They're very listless, very fatigued. Some other mood disorders are obviously major depression, and then we have persistent depressive disorder, which is depression or depressed mood that lasts for at least 2 years, and might have a little bit different signs, symptoms, different effects than just depression in itself, but it definitely is that longer experience. Other forms of depression are postpartum depression, seasonal affective disorder, and bipolar disorder. Postpartum depression, which is a more serious baby blues, if you will, than what most women might feel or experience after giving birth. And this is usually due to hormonal and physical changes, and also the new responsibility of caring for that newborn. You know, those changes can be very overwhelming. About 10 to 15% of women experience postpartum depression. Seasonal affective disorder is characterized by the onset of depression during the winter months when there is less natural sunlight. It usually lifts during spring and summer. It may be effectively treated with light therapy, but sometimes people will need extra care, extra therapy, extra treatment alongside that. And then we have bipolar disorder, and this is sometimes called manic depressive disorder, where these people have very high highs, they're very energetic, they're very excited, they're very go, go, go. Sometimes they have hallucinations, sometimes they have grandiose ideas when they're in this manic state. And then a quick mood change all the way down to very depressive, very sad, persistent state. This is going to cycle from the extreme highs to the extreme lows. Approximately 2.5% of U.S. adults experience bipolar disorder, and the median age of onset is roughly 25 years. It's common equally in both males and females. One sex doesn't outweigh the other like depression does. Regardless of the disorder that may be present, or regardless of the disorder that you have, the signs and symptoms that may be present are going to be similar for each. The person might feel guilty or hopeless. They're going to be persistently sad, anxious, or have empty feelings. They might feel irritable, restless, worthless, or helpless. They're going to have a loss of interest in activities or hobbies once pleasurable. They might feel fatigued, decreased energy, difficulty concentrating, remembering details, and making decisions. They might have changes in their sleep cycle or sleep patterns. They're not sleeping well enough, sleeping too much. Same with eating. They're eating too much or not eating enough. They might have thoughts of suicide or attempt suicide. And again, they're going to have those aches and pains, physical problems, headaches, cramps, digestive problems. Additional signs might be changes in thoughts, and then also changes in attitudes and behaviors. Many people with depressive illness never seek treatment, but the majority, even those with the most severe depression, can get better with treatment. Medication, psychotherapies, and other methods can effectively treat people with depression. One of our less common mental disorders that I'm going to discuss today is schizophrenia. Schizophrenia is actually a psychotic disorder. Psychotic disorders are far less common than the other disorders, and they usually involve a very severe and disabling episode or episodes. There are a few disorders where psychosis, which is the general term that's used to describe a mental health problem in which a person has lost some contact with reality, um, resulting in severe disturbances in thinking, emotion, and behavior. Psychosis can severely disrupt a person's life. Some of the disorders that that a person might have psychosis, or psychosis might kind of appear, would be bipolar disorder, psychotic depression, a drug-induced psychosis, delirium, and schizophrenia. Okay, so psychosis is kind of a state of being. It's an episode that somebody might have where they're feeling disconnected from the world. They can't really make good choices, and maybe somebody who has psychosis might have a delusion or a hallucination or a combination of both. Delusions are going to be those false beliefs of persecution, having a special mission. Hallucinations are most commonly involving hearing voices, but they also might be able to see things, smell things, feel things. Psychosis usually occurs in episodes and is not just a constant condition. Schizophrenia is a psychotic disorder with the major symptoms of delusions and hallucinations. Schizophrenia comes from the Greek word meaning fractured mind, referring to the changes in mental function where thoughts and perceptions become disordered. Folks with schizophrenia may shift from one thought to another with no obvious connection. They may also make up their own words or sounds or things in place of words. Some other symptoms of schizophrenia, besides the hallucinations and the delusions, are, if we're looking at emotion and motivation, they might have depression, anxiety, irritability, suspiciousness, blunted emotion, change in appetite, reduced energy, and motivation. When we're looking at some thinking and perception symptoms or signs, we might have difficulties with concentration or attention, a sense of alteration, such as the feeling that they or others have changed or are acting differently in some way. They might have odd ideas, an unusual perceptual experience, reduced or greatly intensified sense of smell, sound, or colors. They might start to behave differently. They might act childishly, make odd repetitive movements such as shaking of the head. They might dress inappropriately, maybe wearing a long coat in summer or wearing shorts in the winter. They might become catatonic, just kind of sit there and not move for hours on end. They might start to ignore their personal hygiene. They're definitely going to have changes in their sleep behavior, sleep patterns. They're going to overall have reduced ability to carry out that role, that role that I keep talking about, a brother, a father, an uncle, a boss, a whatever that role might be. They are going to have a very difficult time fulfilling that role. A person with schizophrenia might also withdraw from everything. They might have to avoid eye contact. They might give up on their goals. They won't have the motivation to do much of anything. They might start to reject or withdraw from their friends and family. They kind of just maybe stay at home all the time, shut all the curtains, lock all the doors and the windows. They don't answer their phone anymore. They're just kind of themselves, like all by themselves. Their unusual behavior might also cause others to shy away from them, adding further isolation. Most people with schizophrenia will experience their first episode between the ages of 15 and 30 years old. Folks in this early stage of psychosis often go undiagnosed for 1 year or more before receiving treatment. Schizophrenia affects more males than females, and males tend to develop at an earlier age. It might be rapid, over several weeks, or it might take several months or even years before schizophrenia signs and symptoms is full-blown. Jumping back up to a little bit more common, higher rate mental disorder is substance use disorder. Approximately 3.8% of U.S. adults have a substance use disorder in a given year, with the majority involving alcohol, alcohol being the number one legal drug of choice, while marijuana is the number one mostly illegal drug of choice with regards to medical marijuana, or the two states that have now legalized it for recreational use. Substance use disorders tend to begin in early adolescence or early adulthood with a median age of onset of 20. 75% of people will develop a substance use disorder by the age of 27. There are about it is about two times more common in males than it is in females, and it will often co-occur with mood, anxiety, and psychotic disorders. So the people who are experiencing those types of disorders might be self-medicating because they can't cope with what they're experiencing, so they're going to use alcohol or drugs to kind of help them feel better, make them forget about it, whatever might be going on. But also research is looking at, there is a correlation. We know that people who have mental disorders, we have a higher rate of substance use disorders among them. But also, people who have substance use disorders have a higher rate of mental illness. So what research is really trying to figure out is, do I have a mental illness because I used drugs or alcohol when I was younger, or am I using drugs or alcohol as a young person because I'm trying to cope with these negative feelings or experiences that I'm having? Also, there are several different types of substances that people might abuse. Obviously, alcohol, marijuana, tobacco, cocaine, and all those more illicit drugs are definitely on the list. But we're seeing an increase in use of prescription as well as over-the-counter medications to kind of cope or self-medicate with some of these illnesses. What might a drug use or drug dependency look like? Just a couple of brief signs and symptoms of substance use disorder. The person might be increasing their tolerance, meaning they can maybe use more and more than they had previously, but they still don't seem to be getting drunk or high. So when somebody first starts using alcohol, it might take a couple of maybe cans of beer, for example, before they start to feel drunk, before they get buzzed, before their behavior is changing. With increased use and tolerance build up, that person maybe can drink a 12-pack of beer before they feel buzzed anymore. So tolerance increases. Without use, they might go through withdrawal symptoms. So I stop drinking beer, or I stop using marijuana, or I stop using whatever, and now I feel sick. I have a fever, I'm trembling or shaking, I'm sweating, I have an upset stomach, I have problems, with whatever, decision making and thinking and concentrating. With abstinence, if there is withdrawal symptoms, that might be a sign that they might have a substance use disorder. If they are having a problem controlling their use, they can't seem to stop, or they're just doing it all the time. They spend a lot of time getting it, using it, or recovering from it. If they're giving up on activities because of use, they might rather go to the bar and drink, or sit in their garage and drink a six-pack, or smoke marijuana than hang out with friends, or go see, their kid's baseball game or something like that. And obviously, if they're continuing to use despite negative consequences, whether that be trouble with the law, trouble at home with family members or spouse, physical problems, they are continuing to use this drug because they don't either A, recognize that it's causing these problems, or B, if they stop using it, they have even more negative consequences. That might be a sign. So what can we do? Maybe you think, some of these signs and symptoms are familiar to you. You know somebody who maybe is experiencing some of these things, or maybe you yourself have experienced some of these things. What are some things that we can do to help? The most important thing that we can do is know that recovery is possible and treatment is available. The earlier a person receives treatment for mental illness, the better chance the person will have of recovering or at least being able to manage the illness and live well. If you are a family member, a friend, or the individual experiencing the mental health problem or illness, there are some more things we can do. Remind them that help is available and that mental health problems are common and treatable. Express your concern and support. Let them know that you care and you're available to help. Continue to include them in your plans. In other words, don't treat them any differently. Be respectful, compassionate, and empathetic. Educate yourself and others on facts of mental health problems. Communicate in a straightforward manner. Don't make promises regarding silence. I won't tell anybody, that you're experiencing this. I won't tell anybody that you're thinking about suicide. Don't make promises about treatment. Oh, you won't have to go to treatment. You won't have to go anywhere. You won't take any medicines. I promise you'll recover. Everything's going to be great. It'll be perfect. You want to be straightforward. There is hope. I mean, people can recover. There is treatment available. Sometimes it takes a little bit to find the proper treatment, but it is out there. But you need to be honest with them and say, you might have to take medicines, but that's something that we might need to discuss further down the road. We'll talk to a doctor about it, whatever. And make sure you discuss this topic in a safe and comfortable setting. Don't criticize them. Don't judge them. Don't attack them somewhere in a public space where it might be embarrassing for them. Sit them down, calm, comfortable, maybe at the dinner table or over coffee somewhere, or, hanging out at their house. Just sit them down and tell them, hey, I'm concerned about you. I've seen this happening. I've seen these changes. Maybe we should think about getting some help for you. Maybe there's some people that we can go to for help. We can take you to. We can schedule an appointment and get you talking. Some people think that mental health problems are a character flaw and that they are just bad people because of it. Or they think that getting help is a sign of weakness. But in reality, seeking care is a sign of strength, and the sooner help is available, the sooner you can begin to recover. So where can you send them for help? We really want to make sure we can connect our friends, our family members, or even ourselves to care. We may choose to seek the help of a local mental health agency, such as North Central Behavioral Health Systems, or you may begin with your family physician. Finding the appropriate professional care is going to be the key to recovery. If you have severe symptoms, you need help. You need professional help. If your symptoms aren't so severe, you might be able to go to, self-help section at a bookstore and buy some things about, thinking differently or positive ways to, think, whatever it might be, cognitive behavioral therapy. Those might be helpful for kind of mild symptoms, but if your symptoms are severe or if those self-help things aren't helping, it's important that you go to a professional. You can start with your family physician or look at mental health agencies. You may start also with maybe a work or school personnel who could refer you to the appropriate professional. Sometimes you may turn to your faith leaders. A lot of times they have connections to agencies and other places that people can help. But the sooner the person begins professional treatment, the better they're going to be. The more likely it is that they'll recover. If I'm suffering with signs and symptoms for 5, 6, 7, 10 years, maybe sometimes people will go that long before they seek treatment. That's done a pretty negative toll to my life. It's going to be hard for me to recover from some of the things that I've done, the way I've been feeling for so long. The sooner we can get help, the better it's going to be for all involved. Be aware, though not all treatments and therapies work or work right away. It may be a challenge to find the appropriate fit, the right doctor, the right meds, the right therapies, the right whatever it might be. The important thing is that you keep trying. Everybody's different. Everybody experiences things differently, but keep trying, finding the way to work. And there's no magic button. There's no magic pill. You can't just walk into a doctor's office. He can't give you a prescription for an anti-anxiety medicine and you feel all better. The person who has the disorder has to work as well. They have to be present in their recovery. Looking at some other things that we can do to either prevent or potentially maintain our mental wellness. You know, it does affect 1 in 4 people, so 20 to 25% of our population at any one time has a mental health problem or mental health disorder. It is common, but there are a lot of us who have ups and downs, goods and bads, and can just benefit in general from doing some preventative or some maintenance to our mental health. So in general, somebody with good mental health is going to have a positive attitude. They're going to look forward to the challenges of life. They're going to feel good about themselves and others. And they're going to act responsibly in their work and in their relationships. But it takes work. It takes practice. It takes effort to stay well. One thing that you can do is build your self-esteem. Having a good self-esteem, seeing yourself as a positive person, as a good person, as a key component to whatever might be going on in your life, can help increase your self-esteem, which is how you think or act or feel about yourself. When self-esteem is high, we're more likely to have a positive outlook on life. You know, we're going to find life to be satisfying. We're going to establish strong, healthy relationships, set and achieve goals, take life's ups and downs in stride, and have confidence to overcome. When self-esteem is low, we're more likely to feel that life is beyond our control. We might be overwhelmed by stress and avoid accepting challenges and expecting failure. Some things that we can do to build self-esteem, whether I have high self-esteem already and I want to make it stronger, or if I have low self-esteem and I need to increase it, I can be honest with myself. You know, I might not be the best at whatever. I might not be the smartest person, but I'm pretty smart, or I'm pretty good at this. You know, if I set myself up, if I have expectations that are higher than I might be able to reach, I'm kind of setting myself up for failure and a pretty big disappointment if I don't achieve what I'm looking for. Be willing to improve. Practice makes perfect. I'm not the best at everything I'm going to do, but I'm going to give it my all. I'm going to try my hardest. I'm going to practice at doing this. I'm going to get better at it. Whether that be, you know, something at work, maybe you want to get a promotion, you know, practice at whatever you need to do in order to reach that promotion. Setting goals can also help, and then obviously reaching goals can help build our self-esteem. Another thing we can do is take care of our mind and our body, having a healthy body, eating right, exercising, going to the doctor for my regular checkups, going to the dentist for my regular checkups. Those are all things that are important to keeping my body healthy. A healthy body is a healthy mind. Learning to deal with stress and other negative feelings, and then seeking help. Learning to deal with stress and other negative feelings, boy, do we live in a stressful time. So what are some things that we can do in order to manage stress? You know, we all know that stress is an unavoidable fact of life. It's part of our daily life. It's part of what we need sometimes to prepare ourselves for what's coming up. Stress is our body's way of preparing us for a challenge or a threat, whether it be a job interview or a car crash. Sometimes stress is helpful. It's going to cause physical reactions such as an increased heart rate, breathing, blood pressure. It's preparing me to do something. However, if there's nothing that I need to do about that stress, if I can't find a positive way to cope with that stress, those physical changes can oftentimes be damaging to my body. We're all going to respond to stress differently in different levels. Think about some ways that you physically react to stress, or mentally. How do you cope? What are some things that you do? Usually, when the stressful event is over, so goes the stressful reaction. The heart rate decreases, the sweating stops, the butterflies go away, whatever it might be. I'm nervous about presenting. to somebody, I'm nervous about this job interview, I'm nervous about driving in the winter, those things all cause stress. And when I get home from a snowy drive home, I'm not stressed out anymore. When I walk out of that office after an interview, I'm not stressed out anymore. When I finish my presentation, I'm not stressed out. I don't have those feelings anymore. They go away. Normal stress is going to pass. However, if that stress doesn't pass, if it's too much, if it lasts too long, that can be harmful. It can be toxic to our body. It can make us physically and mentally ill. Chronic stress, research is showing, leads to physical problems, such as heart problems, headaches, ulcers, and other physical things. Not to mention emotional challenges or problems such as depression or anxiety. Stress and how you handle it affects your health and your happiness. So what can you do to manage or cope with stress in your life? We want to try to limit stressful situations by avoiding the situation that upsets you. For example, I don't do so well when I drive in traffic. When I go up to the city of Chicago is a couple hours away from here. So if I drive up into the city, that causes a lot of stress. How do I deal with that? I now take the train in. I don't have to worry about driving. I don't have to worry about parking. I don't have to worry about other drivers. I don't have to worry about the interstate. I don't have to worry about traffic. I just get to relax, take the train on in. I avoid any stress that might have been involved. I get to the city, I'm happy, I'm relaxed, I'm ready to do whatever I'm there for. Try to organize your time or so that you can decrease the pressure of rushing or last-minute tasks. This will also give you extra time to do things that you enjoy. So being prepared, making a plan, organizing. Okay, don't wait until the last minute to do everything. Start your chores earlier. Don't wait until the deadline to start working on your portfolio or whatever it might be. Be realistic. People who expect too much of themselves can get tense if things don't work out for them. Exercising regularly. Exercise, one, it's a good way to just burn off all that stress, but it also releases endorphins and hormones that help you relax and help you feel better. So exercise definitely is a positive thing, not only for your physical well-being, but also for your mental well-being. Learning relaxation techniques such as deep breathing, meditation, or just finding an activity that relaxes you, maybe a bubble bath or walking your dogs or playing with the kids, whatever it might be that just kind of helps you chill out and relax. Talking with others about your frustrations or your problems, whether it be a friend or a coworker or your boss or a spouse, a mother, whatever, whoever it might be. Oftentimes, just getting that stress off your chest can help you feel better, but also it may help you find a solution to the problem. Staying away from drugs and alcohol and other drugs is a good thing also, because we know that drugs and alcohol oftentimes just exacerbate our emotions. If I'm in a bad mood and I consume alcohol, I'm just going to be a mean drunk, or I'm going to, have a bad attitude and start fights and just be ornery to people. The relief that may be provided from using alcohol and drugs is only temporary. It's not going to help you solve the problem. In fact, it might actually cause more stress or cause more problems. So finding a positive way to cope with the problem is what we want to do. And if your stress is getting out of hand, if it's hard for you to control, it's really important that you seek help for that before it does become, an issue, before it does become a problem. And another good way to just kind of live life well is this wellness wheel. And this wellness wheel came from Marquette University, but I learned about this wheel when I was back in college. And I think just having a balance of what's going on in your life can really help improve and maintain just that positive feeling that we have. Oftentimes we get so focused or worked up about one particular thing, and it's going to throw our wheel off. If it's going to unbalance us. So staying balanced, keeping connected with all 6 of these realms, and you'll see some of these wheels have 3 realms or 7 realms. one I chose has 6, and I'm going to talk a little bit about each one, but keeping each one of those balanced will help us stay prepared for any negative stuff, but keep us mentally well. The physical dimension is going to recognize that we need to maintain a good, healthy body, good nutrition, regular physical activity and exercise. We want to avoid any harmful habits, make informed and responsible decisions about our health, and seek medical assistance when necessary, including regular checkups. Our emotional dimension recognizes awareness and acceptance of one's feelings. It's going to include the degree to which one feels positive and enthusiastic about oneself and one's life. It includes the capacity to manage one's feelings and ability to cope effectively with stress. Occupational is looking at personal satisfaction and enrichment in one's life through work, traveling a path toward our occupational wellness. Contributing your unique gifts, skills, and talents to work is both personally and professionally meaningful and rewarding. Questions of meaning, faith, and purpose have long represented the core experience of human beings across cultures, religious beliefs, and traditions. As seekers, we humans have leaned on faith and spiritual teachings to help answer our sacred questions and help understand our everyday life. The spiritual journey, as such, represents openness to something of mystery. Openness to something more in our lives. As we accept the tension between what we know in our lives and the presence of mystery, or God, in our lives, many of us are drawn to spiritual practices and disciplines. Some of us may find our spiritual path through formal religious denominations, and others will pursue a more personal method of leaning into the sacred. Again, having that balance, having something to believe in, often believing in something larger than ourselves can help us stay kind of grounded and balanced. The social dimension encourages contributions to our environment and our community. As you travel a wellness path, you'll become more aware of your importance in society as well as the impact you have on multiple environments. You'll discover the power to make willful choices to enhance personal relationships, important friendships, and build a better living space and community. Some people maybe have just a small social circle. By expanding that, and it doesn't necessarily mean that you have more friends, but just doing more things for your community, whether it be volunteering or coaching your kids' soccer league or whatever it might be. Those all increase our social circle and thus keeping us balanced. Life can't just be all about you, or even your family. Open your eyes, broaden your horizons, experience things within your community. The intellectual dimension is going to look at one's creativity, stimulating mental activities, and expand their knowledge and skills while discovering the potential for sharing gifts with others. As you develop your intellectual curiosity, you'll actively strive to expand and challenge your mind with creative endeavors. Reading, communicating with others, again, expanding your mind, expanding your horizons, looking broader than what's right in front of us will help us stay balanced. Keeping our life balanced and keeping our mind and body healthy can really help us to continue to pursue a productive, happy life. I want to thank you for spending your afternoon with me. If you do have any questions regarding the presentation, please email info@ncbhs.org. If you're looking for any more information on any of the topics, the disorders that I mentioned today, please go to North Central Behavioral Health System's website, www.ncbhs.org. And you can click around there and see information on the different disorders, where to go to for help in our particular area here in North Central Illinois. And I hope that you have a wonderful day. And please, again, thank you so very much and be well.